So Leigh syndrome is a inherited neurometabolic disorder in which mostly gene related to oxidative phosphorylation in mitochondria and nuclear DNA are affected mostly. So it affects mostly infants, but later onset is also observed in adults. And after onset of the disease, lifespan is limited for around 2 to 3 years. So this is the TPP which I prepared. So currently there are no permanent treatments available for the disease. Current treatments are mostly symptomatic, which only treat the symptoms of the disease, which include mostly antioxidants and vitamin B1 supplementation. So this is a TPP which I prepared for my hypothetical drug, which I'll be preparing, which I can name as LS Thera. So this is the.
So if I can ask just,
Yes.
what do you mean with efficacy? The survival, improved motor function, ATP levels?
Efficacy.
Yes. I mean that, survival, if they will survive longer than it is already, do you mean with that symptomatic treatment, or do you mean with that treatment which is stopping progression?
I'm trying to, sir, actually symptomatic treatments are already available.
Mm-hmm.
So I'm trying to develop a treatment which can address the root cause.
Uh-huh.
So what I'm trying to do is I will have nanoparticles which will have the I can use gene therapy or something loaded on those nanoparticles, and they can address the gene which are affecting the oxidative phosphorylation.
Okay, so you mean with these nanotherapeutics, you mean gene therapy?
Yes.
Okay, so it's a good example because if you go back to previous slide,
Yes, sir.
so you are saying here that you have mutations, many different mutations in nuclear genes, which means that theoretically, if you have such situation, you should have, for each mutation, you should have individual therapy. It's quite complicated. You need a lot of therapies in that case, because they are different.
These cases will be addressed, then it should work at infant stages, or if we know that the mother is carrying the defective mitochondria, then we can take precautionary.
And then another thing is that you have here mitochondrial genes also. So it's two interesting points. If you plan to have a gene therapy, you're going to have a gene therapy against nuclear mutation. But currently you can't have a really gene therapy for mitochondrial mutations, because it's mitochondrial DNA. How you will change that with current tools? And another interesting case here is, if you're speaking about gene therapy, is that what is the current legislation that you will have a gene therapy against one specific mutations, you will do all this development registration, and then if you have another mutation in another gene, you need to do it again against other mutation. So they are planning to make it easier in future. Maybe it's already happening, that you register all these possible therapies once, and if you will have then something against slightly different mutations, you don't need to do paperwork again. So therefore it's a good example disease to explain that it's mitochondrial problem then, and it's coming from mitochondria, then your gene therapy is not helping. And this current treatment, it's vitamin cocktail or specific vitamin, or actually also others, it's not really very good treatment. It's just helping a little bit. And what is interesting that only some subgroups are sensitive to this vitamin treatment. Some subgroups are not. Good. Thank you. So we can go on. Who will come? So please, don't hesitate. You need more time? Or, okay, if you need more time, then we can wait a little bit, but if you are ready, then please come. So, you are ready. Even if you are not fully ready, it's to be part ready is okay. It's not working.
Hello. Okay. So this is a target drug profile for Alexander's disease. So Alexander's disease is caused by mainly accumulation of GFAP protein in white matter of brain. So we have found a drug ION 373 which is already in the clinical trials, and this is the drug profile for this one. So when this drug was administered, there is reduced in pathological GFP production, and it can be administered for more than 2 years of individual to 65 age, and treatment duration is more than a year, and regimen once in every 12 weeks, and efficacy is showed more than 30% stabilization in gait speed, side effects mild, and therapeutic mobility. As I told, this drug ION 373, so it is an antisense oligonucleotide. It targets specifically GFAP gene, and it silences this GFAP gene, and results have showed reduction in GFAP protein normalization. That's it.
Okay, that is very good, because this antisense therapy is under development currently, but even if it works, then it's not perfect. The best is to have something which is silencing it more efficiently and which could be used as a single dose therapy. And since there is no treatment available, then we will be very happy if there is only very small treatment effect. It is anyway good. Thank you. Very good. So somebody is ready to continue. a few minutes break and continue.